You know how we all talked about liquid biopsy, tissue biopsy? How do we approach the discordant results between liquid biopsy and tissue biopsy? Like, say, you see something in the tissue, did not see it in the liquid, or other way around, you see something in the liquid, and then you don't see it in the tissue. What does that mean, and how do you approach that situation? Whoever wants to start, and then we'll go from there.
Yeah, I can start with answering that question. As far as some of the discordance between the tissue and the liquid biopsy, sometimes what we can see is that if we find something on the tumor biopsy, but we don't find it in the blood, it can just mean that there wasn't enough of the tumor DNA to be shed into the blood. So that's why there can be the discordance there. Now, as far as, the other way around, why we may not find, while we may find something in the blood, but not find it in the tissue, it can just be that, as far as the biopsy goes, we picked a spot where, we picked a spot that maybe missed or didn't have, that tumor or tumor spot just didn't have that mutation, just because the tumor can show, heterogeneity, can, have differences in its molecular profile based on sometimes where we biopsy. And so that's where we can see the discordance there. I think that when, as far as, the specific mutations that I see either on the tissue or in the blood, if there's a mutation that's specific enough for lung cancer, and, say this is a patient with metastatic or advanced disease, I would use that information to go ahead and start treatment because if that mutation is there, I would be, I think that would be enough information for me to utilize a targeted therapy.